Hi everyone, welcome back. May is Mental Health Awareness Month, and we know how important it is to have mental health as a part of your entire health. We also know that there's lots of strategies and techniques that we can do to protect our mental health. In kicking off Mental Health Month, we are going to start a 4-part series talking through a couple of different topics on how you can help protect yourself during this time. Today we're joined by Clint Thurgood, Intermountain's Director of Behavioral Health Crisis Services. Clint, thank you so much for joining us. We really appreciate it.
Thanks for having me, Amanda.
So, in the light of COVID-19, many of the community members and the media are hearing a lot about how important mental health is to our whole health. And a word that I keep hearing is resilience. Can you explain what that is?
Sure. Many people think of the term of resilience as the ability to spring back or to come back to how things were prior to an event or prior to trauma or prior to a situation happening. And I think some people mistake that for thinking that things will be back to 100% as they were before. But really, I think resilience is more, I think of an example of resilience being seen in the trees that are near canyons. So I work quite often at McCady Hospital, and as I drive through Layton to Uinta, every morning there's a really stiff breeze, quite forceful winds that come through the canyon in Uinta. And every one of those trees is growing somewhat at an angle. Mm-hmm. Now that to me is what resilience is, being able to adapt and being able to accommodate and being able to change to the situation around you.
So why is resilience so important during a stressful time like COVID-19 with what we're experiencing? I'm sure that we're all trying to adapt, like the tree example, to what's going on right now. Why is this so important for us?
Humans like normalcy. We like routines. We like to be able to expect things throughout our day. I think back to when I was a child and I grew up next door to my grandparents. My grandfather died when I was the age of 7. I remember thinking to myself, wow, things will never be normal. Things will never be the same again. 5 years later, my grandmother died. Also lived in that same house. Things will never be normal. Things will never be the same. Then we have a more recent incident for those who are adults. 19 years ago, we had what occurred in New York City. And as a young 20-something-year-old with a toddler and a newborn on the way, I thought, wow, this will never be normal again. Things will never be the same. And what I've learned from that is normal is how you define it, and it's redefined really every day. Every day we have to ask ourselves, what is normal about today? How do we define our new normal? As you think about what we've done with airports over the last 20 years, it's not the same as it was pre 9/11, but it is a new sense of normal. And now here we have COVID-19 and we're in the middle of a pandemic, and our definition of normal is redefined every day. And that's why resilience is important, is because we're challenged to look at what is happening around us and how can we be comfortable with what today brings.
I think the example of 9/11 is really important. I know that for myself, I remember exactly where I was when that happened. I lived on the East Coast, so it was in real time. I was awake in school. And so I think it's really important to know that when you think back about all these different things that have happened to you, you'll start to remember certain parts of it. And the resilience piece will come up. You'll think about, what did I do then? And what can I apply what I learned then to now? Which I think is really important to think about what else you've gone through in your past and how you can apply that to what's happening right now. So there sounds like there's a lot of really good benefits to being resilient and understanding how to adapt to change. What about the term coping? Can you tell us a little bit about what that means and why that also matters with mental health?
Sure. Coping is really an active effort to help manage a stressful situation, whether that be the situation itself or the emotional response to that situation. I met an individual once who had been hospitalized several times because of an inability to really manage that stressful situation in his life. And he had been rehospitalized month after month after month. And then for years, we didn't see this individual. A few years later, he came back in, and I asked him what had changed, if he had been on a trip somewhere. And he said, you know what, I was under the impression that I was waiting for the magic pill, or I was waiting for the magic combination that would just unlock my brain so I could be fine with everything. And then one morning I woke up and I thought, you know what, I don't feel great. But I know that if I go have coffee with my buddy up the street, that I'll feel a little bit better. And if that didn't work, I knew that if I took a trip to the park and walked around and looked at the flowers, I would feel a little bit better. It really is an active change, an active process to cope. If you think about in the terms of a river, we don't stand at the side of a river saying, I'm going to cross that river as soon as it dries up, right? That's like the same thing with coping. I'm going to cope, or I'm going to change, or I'm going to take accountability over my life once things are in a better situation for me. Now's the best time to do it.
Yeah, I think people really need to understand too that COVID-19 is not something that you might think of as a loss of something, but the term cope for me always comes up with grief and what have I lost. So I think it's important for you as a friend or family member to understand that people are going through different levels of grief right now in a way too, and trying to cope with their new normal and figuring out how best to go about their life now, and especially kids. I know that children, their schedules are completely different. Being in high school or elementary school, you have a very structured schedule of I wake up, I go to school, I get to hang out with my friends, I have interaction with them, and that's really important. What advice would you give to parents right now about how to help their children cope with this change in schedule and this loss of normalcy for them?
So going back to what I said a few minutes ago, humans thrive on structure and expectations. Children who have a regular sleep habit, that should continue. But really life as normal as we can define it needs to continue. The term connection keeps coming to my mind, is that even though we're separated from our schoolmates, or in some cases our work colleagues, we still need to find a way to connect with ourselves, connect with the environment around us, and connect with each other. And as we think about the challenges that the school faces now with our children, it's different. It's not necessarily bad. We give it that definition. If something is good or bad, that's internal. Yesterday morning, I had the opportunity to go to the high school where my daughter is attending, right? And she's going to graduate high school this year. And graduation is very, very different. We can't say that it's bad or that's horrible or this is paralyzing. It's different, but we get to define how that how graduation will go for her, how we will celebrate her successes. And I think that's important for children, is to still be able to expect that nurturing voice from a parent, or the normalcy of their day of being able to connect with people who are important in their lives.
What about other family members that are not just children in your lives, but maybe adults or siblings that you have? How do you help them cope with the different challenges that COVID-19 presents?
Again, I would put this back on the term connection. We know that a pandemic and a change of lifestyle is a breeding ground for anxiety, for depression, for mental illness, for fear even. And we have a responsibility not only as brothers and sisters and neighbors, but as society, to make sure that we're checking in on one another. Those who maybe don't cope quite as well as others, they need that extra support. And what we want people to know is that support is available, whether that be the emotional wellness support line, the relief line, or our access centers, or our emergency departments. What I found quite interesting is we have these resources available, and in this time of the pandemic, some of our resources are a little underutilized. And in the term resiliency, different facilities and programs and outpatient services have had the opportunity and the challenge to continue to find ways to virtually connect with people, whether that be through a video visit with a talk therapist or a psychologist, or that be the emotional wellness line to connect with a navigator to find out where they can go to speak with a professional who could help them with coping.
Resources are super important during this time, and I think it is very important for people to know that those are not just shut off just because our hospitals or clinics are maybe accepting less people right now. Those resources are still available. You mentioned the emotional health hotline that we have. There's also the access centers. Can you talk a little bit more about If someone doesn't have a provider right now, someone they can speak to, is it still possible for them to get a provider to help them talk through maybe some issues that they're having?
Sure. So the emotional wellness line, the caregivers who are on the phones there are able to connect with patients and help them line up a scheduled video visit. And some of our clinics are still seeing patients in person, taking, of course, measures to make sure that social distancing occurs and that safety is priority one. But we also have the ability to see them in person if they were to come to one of our 3 access centers. And the access centers, think of it as an urgent care walk-in center for people who are experiencing mental health crisis. We have access centers at LDS Hospital, at Dixie Regional Medical Center, and at McCady Hospital up in Ogden, where patients and loved ones can come to the hospital and speak with a licensed therapist, a crisis worker, a nurse practitioner, and in many cases, a psychiatrist. They're on site.
So we're not shutting people off from care. We're still here and we're still available. It's just a different way to kind of get care right now, which I think is really important for people to know. Clint, is there anything else you wanted to tell people on resilience and coping and what people can do during this time?
What I hope that people will remember during this time is that it is important to stay connected with those who are important in your life. Reprioritize. This gives us an opportunity to look at these challenges and take these lemons and make lemonade out of them. Today, I had plans to be in the Bahamas with my family. Here I am at work. Again, it's not bad. It's an opportunity to grow, to learn from it, and I think that's something that everyone should remember, is that we need to stay connected, especially as people around us in our communities are faced with different financial hardships. Maybe they've lost jobs. How can we take care of ourselves, and how can we take care of our neighbors? And that's the message that I hope that people remember, because that's really the crux of mental health, is a feeling of purpose, a feeling of connection again with your environment, with yourself, and it's important to maintain those connections and even build them in these really, really odd times.
I think the thing you brought up about change being good or bad and us being able to define that is also really important. I think people should take that into consideration when they go about their days now. Is change is going to happen. It's inevitable, but whether you define it as good or bad is up to you. So Clint, Thank you so much for joining us. We really appreciate it. That phone number for the Emotional Health Relief Hotline is 833-442-2211. It's available 7 days a week from 10 a.m. to 10 p.m. We also have our COVID-19 hotline that you can still call if you'd like to get screened or tested for COVID-19. That phone number is 844-442-5224. There's also a few other resources available on our blog that you can access. We'll put that link up afterwards so you guys can view those. We have blogs talking about physical health, mental health, and emotional health, just to help you guys get through these times. Thank you so much, everyone. Stay safe, stay home.